just on the other side of Tuscaloosa County. The service provider over there can afford to put one ambulance over there. Well, on Christmas Day of this year, 2023, get a 911 call, ambulance goes to treat that particular person, gets another one. Gentleman's having a heart attack. Well, by the time they got, anyway, by the time they got done with that particular matter and got over to the other gentleman, he had died in front of his two children. So this is not a money grab. This is about providing the level of services that Alabamians are entitled to. Thank you, Mr. Chairman.
Thank you for that. Yeah, we can do questions now. President Woods?
I just had one quick question. Going back to the requirement of additional services for this increase to 325%, do you know of any other states that had that mandated for expanded services in order to receive that additional?
I'm not aware
in
of that.
Louisiana or Texas or wherever you just mentioned?
In order to get the increase, you'd have to
As a
expand
part of the legislation that was
No, sir.
proposed? Okay, thank you.
Thank you. Got
Is there a difference in the reimbursement rate on in-network versus out-of-network?
Yes, sir. In-network, you get a higher reimbursement rate. Out-of-network, you get a lower reimbursement rate, but you have the opportunity to balance bill. So as a result of what some may perceive to be inadequate reimbursement rates, they opt to go out-of-network so they can try to balance bill their patients and hope to recover more cost.
What prevents in-network
Contractual agreement between the provider and the health insurer.
Okay. Any other questions? Thank you. Sure. Next, speaking in opposition is Robin Stone.
Good morning, Mr. Chairman, members of the committee. My name is Robin Stone. I am the Executive Director of the Alliance of Alabama Healthcare Consumers. First of all, let me tell you a little bit about the Alliance. The Alliance is employers. They're employers, public employers, small employers, large employers across the state of Alabama. And the one common thread that we have is they all provide health care benefits that they predominantly pay for their employees and their workforce. Over 50% of all Alabamians receive benefits from their employers who provide these benefit plans. That's over 2.75 million people. Point being there is, in mandated benefits like this, those are the people who are paying the cost. So obviously, it's not shared by Medicare, Medicaid, and government-provided health care. Employers of all sizes, but particularly the small businesses, are stretching every year to continue to provide benefits. They look for ways to trim costs, and they try to make their numbers work in their plans. Those cost-cutting efforts are erased with one single mandate benefit that raises the pay of one set of providers. They just can't keep up if you're a small business person. This legislation is estimated to cost employers and their employees $52 million per year. The cost of this legislation will go directly to employers. It will not be absorbed by insurance companies. It will be passed on directly to employers who provide these plans and to their employees in the forms of higher premiums. There is no endless supply of health care dollars. Sometimes if you're going to add a benefit, you have to reduce a benefit in another area, unfortunately. Unfortunately, this committee is being asked and pushed into a position away from your legislative role, in my perspective, to a regulatory and a rate-making role. That is not a comfortable place, I don't imagine, for you all to be. You are legislators, and you're choosing. Please push back. Don't be forced into this decision that will benefit a few providers and cost millions in premiums for your constituents throughout the state. Alabama ground-based ambulance services already receive a 12% higher reimbursement rate than the Southeast regional average. In this bill, they're asking for an additional 230% rate increase in statute. All this for no guarantee of additional services anywhere in the state of Alabama. This bill opens the door to providers to come back to you again and again. In other words, this bill passes, they're going to be back here year in, year out asking for rate increases. I don't think that's a place where you really want to be. This bill is an attempt to force this committee and legislature to decide who gets paid and how much. The Alliance of Alabama Healthcare Consumers, we care about the needs of our workforce. Employers count on our contracts that they sign with insurers to stand for something. Legislative intervention on individual contracts devalues those contracts and pushes employers further away from having health care benefit plans that they have to pay for. Thank you, Mr. Chairman. I'll be glad to answer any questions.
Thank you, Ms. Stone. Does anybody have any questions? Stone.
Yes, sir.
When somebody buys health insurance, whether it's the employee or employer, there's a calculated amount in there for ambulance services. Is that right? Is that
For what services?
there's a portion of that insurance premium covers ambulance services. Is that correct? When they buy an
Sure.
insurance,
Yes, sir.
and these people in rural areas are paying for insurance that are paying for ambulance services that are not there. I happen to live in Washington County. There's one ambulance in the whole county. What he described in Pickens County is a common practice. I mean, it's common. So I hear your side, and I don't like government rates, but at the same time, I hear the side. I see that they're paying for it, but they're not getting it. You might as well not have an ambulance service if it's an hour or 2 hours
Yes.
driving, and one in the whole county. Even if they leave, when you mash the button, if they're on the other side, it's 45 minutes to get there. So there's definitely two sides to it. So thank you.
There is. Thank you, sir, for your comment.
Thank you. Representative Colvin?
Thank you, Mr. Chairman. This may be for Robin or Ted, whoever. So when an individual or on these group policies, you're buying your health insurance plan, is there a way to like add an endorsement to your plan? Like I want out of network ambulance services covered, I can just pay extra for my plan. Is there a way to itemize that or no?
I don't think that's.
It's not like a home insurance policy. You can add all these endorsements.
I don't think that's the
It's-
case.
Okay, gotcha.
Thank you, Mr. Stone. Now speaking in support is Eric Penley. Thank you for being here.
Thank you, Mr. Chairman, committee. Eric Penley, the president of the Ambulance Association. Hey, I just first want to say this hadn't been the first and end all be all of trying to fix our issues. In 2018, we started to work. Our association probably had about 20 members. Really just disoriented, I guess you could say. So none of us on the board, I mean, we don't get paid for this. We only afford to pay one lobbyist, not 18 that we see here. And we can't be in, these big associations as well. But we just went to fight because we see what was happening in the street. You guys helped us pass the Medicaid provider tax. That was getting, $70 for Medicaid reimbursement. We tax ourselves. That goes to the feds, and it's really helped put some more ambulances on the street. Hey, we have other commercial insurance that's gave us a 100% increase since 2018. All we're asking for is help. We've had meeting after meeting. We've tried to say over the last 3 years, what can we do with these increases? Where do we go? Other states have done this in legislation because they've met the same resistance as us. If it's not 325, what is it? Let's negotiate. Here's what I want to talk about. I hate talking about numbers, and I hate to talk about dollars, but I want to talk about a 1-year-old in Jefferson County that was unresponsive for an hour. I want to talk about those 2 boys he talked about in Pickens County, watched their dad sit there and struggle to breathe for an hour. In Alabama, just this weekend, a female in a wreck watched her husband or boyfriend die because we can't get an ambulance there from another county away. You talk to Jefferson County's 911 director. Every day we have 2 to 3 calls that go unanswered. They can't find an ambulance for. He's went in his personal vehicle and picked up a stroke. Is there $1 a premium? Our premiums have went up the last 5 years, correct? Is there $1 worth a child's life? That's what I'm fighting for. I'm not fighting Blue Cross. That's what I'm fighting for. And every time I work with Medicaid, anybody at the community college system, I said, everything we work on today, we're saving a life. And we've made a difference, but we've got to have some accountability here too. And we've had other commercials that gave 100% of increase since 2018 where we're at. They have 95% of the market. So any questions?
We got a couple, Representative Blackshear first.
Yeah, thank you, Eric, and thanks for being here. And I'm a novice at this, so this may be a crazy question, but I'm hearing you walk through this. It seems like I'm hearing there potentially, from my opinion, 2 different issues. One, it seems like we've got the challenge from your perspective of what you feel is adequate reimbursement. Another issue I'm seeing is just a shortage of ambulances on the street. Are we trying to tie the shortages of ambulance on the road directly to the lack of where you think the reimbursement rate should be?
Yes,
or is there another issue?
Yeah, and I probably should have done a better job describing that. So we've lost paramedics after paramedics through this attrition through the COVID pandemic, and we got hospitals hiring them for $30, $35 an hour. We were paying them in 18 was $17, $18 an hour. With the Medicaid program, we were able to get them to 22. So we're trying to find ways, because those guys have a calling to serve in EMS. but they are being called to the hospitals to work. So that's what we're looking for, is get some increases for we get those paramedics back in the seats and on the streets.
Okay, so let me dig deeper again. You know it better than I do. So paramedics are leaving for better paying jobs. COVID took some off the streets and they found different career paths.
Yes.
I don't see that being directly tied to the lack of reimbursement personally. That's just me. But you're saying you need the additional 325% so you can have more pool dollars in a bucket so you can use that to potentially recruit and pay higher drivers, paramedics. I'm trying to figure out
Right. So
what the balance is with it. It seems like there'd be multiple issues.
right. You know, and our cost is regulated really by what we get reimbursed. I mean, there's no federal funding, no county funding, no city funding. So whatever you pay us is all we can put on the street. So that's where we're saying we get more reimbursement here. That's helped with the Medicaid. We showed that. We were able to get some more paramedics, and we've seen some staffing increases. Same thing we're asking here. We're only supplying right now one paramedic in Pickens County because that's all you're paying us to do. There's nowhere else to get the funding. So that's why we're asking for the funding.
Representative Wood?
Thank you, Mr. Chairman. What percentage would you say that even the company that you represent collects on balance billing? Of the amount you bill with balance billing, how much would you say you actually realize?
I'm sorry.
How much, what percentage of the balance billing would you say that your industry will just say collects, that participates in balance billing?
I guess, you know, there's 10% probably that's outside of that network, and there's probably, you know, less than 2. And that's one thing just the first conversations we had with this with Ted was like 90% of y'all are in network. Yes, we are currently. But if our costs keep increasing, we may have to go out of network to recover some of our costs from the consumer. So currently, I think there's just 10% of our services are not in network. All of our Alabama companies are. And so that takes away, you know, different languages and different bills would probably take away your ability to go out of network. So that's why we like, let's set that rate and let's do away with balance billing. And like I said, is that rate negotiable? We've sat in senators' offices down or upstairs 2 or 3 times and for 2 weeks, and there's no, I mean, we're willing to negotiate. No budging.
Well, I may not have made my question very clear. I mean, I'm thinking about my local ambulance service that what I assume has to participate in balance billing. Of the monies that are billed to customers, patients, what percentage of that actually ends up being collected by that company, would you
Oh,
say?
by the insurance?
Not by insurance, but what's
yes.
left over the bill?
You're talking about, overall, we're probably looking at, I think some of our colleagues sometimes 49 to 52% collection rates. Because we have probably in Alabama, we still have a 12% indigent care.
Well, I know that what you mentioned about Pickens County having one paramedic on site or in that county at any one time. Y'all, that particular entity covers 7 counties, is my understanding. How many paramedics would you say are on staff at any one time or in any shift in those 7 counties?
You know, 7 counties that I served that you're familiar with.
Yes.
And then what's crazy about that, you know, Jefferson County, I'll just take that. We used to have 11 paramedics on the street a day at the same time. Right now there's 2. And we're using EMTs to fill those seats, but we got a lower level of care. So company-wide, we've reduced our staff. And pre-COVID, we were running, you know, probably 65 trucks during peak hours, and now we're down to 40. So you see the shortage in the call volume still there.
So in Jefferson County, you used to run 11 paramedics, now you're down to 2, and you're filling that with
Per shift.
EMTs, which I know do a great job, but when people call, they probably expect paramedics coming. Most people would, I would assume. And you're saying that is because we can't keep up with inflation, they're being hired out by the hospitals, private health care, whatever the case may be.
Yes.
Okay. Well, thank you very much. I appreciate that.
Representative Easterbrook?
Just a few things. This didn't start with COVID, at least not in my area. It's been going on for 10 or 15 years. There's only one ambulance in the whole county, and there's not always a paramedic with it. It's an EMT quite often, which I'm fine with. I know it's a rural area, but when you can't get an ambulance to show up, it's a different story. Several years ago, we had a man killed on Highway 45, which is not that uncommon either. At the same time, the ambulance was on the other side of the county picking somebody up, and we only had one state trooper, and he was over there where that accident was. That man laid in the highway for 3 hours, and it 100 degrees in July. Now, I have some other questions. How did we arrive at 325%? That seems steep.
Right. And basically, we did look at the other bills from around other states, to be honest. And locally, some of our services, if we've got to get these paramedics at $35 an hour, what kind of increase do we have to have? Blue Cross Blue Shield is probably 12% of the paramedics. We've had step up and increases from Medicaid. We've seen that. CMS, Medicare has gave us increases over the last 5 years. So to make all this work, it's a big puzzle. You got to add the indigent care, and that's a cost, right? We got to figure that in. That's where we got the 325%.
I mean, if you look at your cost, paramedics, I understand, but the rest of it, insurance for an ambulance, paying for the ambulance, fuel for the ambulance, none of that stuff's going up 325%. So, and if you start talking about an investor in the out of network, they're not investing in something that's not profitable.
Right. And we
So,
shared with Blue Cross when we met with them a whole packet. I think you guys got it. Our rising costs from 18 to 23. Liability insurance costs, some places 180% increases. We're eating that. So we've had the increase in cost without any help with the reimbursement. So that's the number we got to get to sustain.
Another question?
I have one more, I promise to be my last.
Okay, Chris.
And I think it ties back into Representative Woods and Representative Easterbrooks and back to my earlier comments. So clear this up for me. Are we saying then that, if I heard correctly, 90% are in network? So the problem arises from basically the majority of the 10%. It's kind of where the problem falls, a lot of the balance billing issues and all the balance billing. So I'm having a hard time how 10% of something's 100% of the problem. Help me make that make sense to me.
100% of the problem is we've not had reimbursement increases in 5 years. That we were getting, as Ron described, 75% over a 5-year period before that you anticipated. So we're in network, right? So for only way I can recover that cost is I'll have to step out of network and try to recover that cost from the consumer. So that has been a big issue. If you'll search that balance billing across the United States, ambulance services were left out with the Trump administration for a reason with that, because you just didn't have a choice. When you dialed 911, you didn't know if you're getting in network or out network, correctly? So we said, let's fix it both. If we're going to have a balance billing bill, we've got to have a rate that we can sustain with. So
Right.
that's why we set both.
The only reason I said that because, so you're saying if you got this 325%, the problem that he just that's been going on in 10 to 15 years, the problem he just talked about in Jefferson County going from what, 12 to 2, would those be rectified? Would he be back up to 12? Would he have more than one ambulance in his county if he
I can
passed? Is that
promise-
guaranteed that can happen?
I can promise you it would be better.
Okay. No more questions.
Thank you.
Are you saying that the in-network are experiencing the same problems as the out-of-network as far as losing paramedics?
Yes. Same. As far as staffing, yes, sir. It's a statewide issue. We have those issues. And, I mean, it's just in Shelby County down there. I mean, I've been working with those guys, and the county's putting in a lot of money to that. They bid that ambulance service out down there, and only one service bid with like a $3 million subsidy. Now the local fire department's going to do it, but they don't have the staff to do it as well. So, I mean, they're having and then if they're going to pull those staff from the local ambulance services, who's going to run the hospital? So it's a staffing issue across the state.
I lied. I do have one more.
Imagine that.
I'm sorry. More I think about it,
One more.
again,
Hey, I
I'm learning as I go
I
here, since
appreciate
we
it.
have questions and conversations. The 325% increase that you're requesting, what's that made up of? Are you looking for an increase from Medicaid reimbursements as well too, or is this just targeted at this insurance coalition as a whole? What's the makeup of that?
This 325% is just really was the negotiations for Blue Cross Blue Shield, just to be candid as it was. We got increases from the other commercial insurers over the past 5 years. Medicaid, we did that provider tax. We went from $70 to $648. The work we did, we actually brought in $1 million to the state Medicaid and Department of Revenue through that program as well that y'all helped us with. So this is really just that 12% of the commercial payer mix. We need to step up. We hadn't had an increase in 5 years. We need them to step up to make this thing work.
All right. You sure? You sure about that? What I'd like to do, so we've got one more speaker. Thank you for your time. We've got one more speaker, and then encourage all the members to, as you have follow-up questions, get with any of the speakers and follow up with those questions later as we digest this. So the final speaker is William Newman with the Business Council of Alabama.
My excuse to go downstairs to
Yeah.
Thank you, Mr. Chairman, members of the committee. I'm William Newman. I'm the Director of Governmental Affairs at the Business Council of Alabama. We have in the ballpark of about 2,500 members. That works out to about 1 million working Alabamians. So I'm here on their behalf to testify in opposition to 401. I think at the core of this issue lies the fundamental question: should the government dictate prices in healthcare, or should the principles of the free market be allowed to prevail? In Alabama alone, the overwhelming majority of ground ambulance carriers, their providers have already reached negotiated, market-set contracted rates. I echo the comments made by Mr. Stone earlier. A proposed government-mandated price increase of 325% of the federal Medicare rate would be an undue burden on Alabama's employers and employees of up to $52 million annually in increased healthcare costs. Imposing government rate setting, as proposed in the bill as written, risks distorting market dynamics. Instead, we would advocate for solutions that preserve market integrity without imposing those undue financial burdens on Alabama businesses. The business community urges the committee to consider solutions that uphold free market principles, that protects patients, and that safeguards the financial well-beings of Alabama's employers and employees. And with that, I'd be happy to answer any questions if I can.
Thank you. Do we have any questions for Mr. Newman? Eastbrook?
I agree with you on the free market principles. I don't like government involved in price setting. But at the same time, you're talking from the employer side. What if the employee is in an area where they don't receive decent ambulance services? What would that employer have to say about this? You have to consider both, because a lot of your employees are in rural Alabama. And, I know some of your the people that are sponsoring the BCA in rural Alabama. Their employees, the majority of them, live in these areas that we're talking about also. I would love to see the ambulance services and BCA and everybody involved sit down and work this out, because I don't like it being done here either. It's just the wrong place for it, in my opinion.
Yes, sir.
Thank you.
Thank y'all.
I
Thank you.
follow up, Representative Easterbrook. I agree 100%. I don't want to have to dictate market prices. I think the market should dictate its own price. However, if you're in a situation where you need this kind of critical care, that would dictate my thinking pretty substantially. And so I hope that maybe the two parties can come together and work something out. That would be ideal. I don't want to have to vote on market setting rates either. But let's not forget, I also represent a rural area. And when folks can't get an ambulance there and they end up dying waiting, what does it really take to dictate the market? Is it dollars or is it lives? And so I just want us to be aware of that.
Yes, sir.
Thank you.
Thank you.
Representative
I
Blackshear?
don't have a question. I have a comment, though, as we go through this process. I think it's important that I don't think any of us in here would want to pay 325% for the same service that we're getting today. I think if you're ever going to get 325% increase on anything, you ought to get more services for what you're paying for. I mean, so let's just keep that in mind as you go through that. I think that's what I'm hearing both of y'all say on that is we don't need to say we need 325% just to keep doing what we're doing, because it sounds like, we're already in a crisis mode in some of the areas. So I just think that's the one thing I wish we can take away as we look at this is, it's not just the reimbursement. Yeah, money's a driver of a lot of it, but in the day, if we truly, the stories that we heard today are sad situations that families shouldn't be put in, let's focus on, okay, then how do we make that experience for them different? It's not just about just getting the money back. If we're not changing the lives and giving people a chance to survive and live longer with their families down the line.
Representative Easterbrook?
Just remember, your employers are paying for insurance that covers ambulance service. If there's no ambulance service to be had, you're paying for something you don't get. So you have as much a stake in this as the ambulance service and Blue Cross and Blue Shield. I would really like for y'all sit down and work this out and make this work. Like him, 325%, I'm not listening to that. That's hard to swallow for me. But I agree with him also. This is not something we should even be voting on here. Y'all need to work that out.
Yes, sir. Thank you all.
Thank you. That does conclude the public hearing portion of our meeting. I do encourage members to continue to the discussion, encourage everybody, including Blue Cross and everybody, please sit down at the table. I think the message is pretty clear that we know something's got to happen here, and we don't necessarily want to do it, but I think we would if we had to. But at any rate, I also want to thank all the members in the audience and the members here for your due diligence on this. Last session, I think we had one meeting that with prayer and everything lasted 38 seconds. This session, we've had some very long meetings. And so I appreciate y'all's willingness to sit here and digest all this information because it's good stuff. It's important stuff. So thank you. And with that, motion to adjourn. We're adjourned. Thank you, sir.